Welcome back and thanks for still being a part of Rise and Shine this morning. We do apologize for the delays around bringing our guest this morning. Of course, joining us on set is Dr. Aniekeme Uwa, who is the coordinator of the Neglected Tropical Diseases NTD's Control and Elimination Program in Akwa Ibom State. You're going to be asking what neglected tropical diseases are. That's why we have Dr. Aniekeme Uwa joining us this morning to have conversation around the campaigns that they are having in the state to look into this particular situation. Good morning, Doctor. Thanks for joining us this morning.
Yeah, good morning. I'm really delighted to be here.
I naturally ask, because of course it has eaten into our time, I'll naturally ask, how was the road coming here?
Terrible.
Part of why, our interview time has really, gone in.
Well, the road is under construction, so lots of potholes here and there.
Okay, so we're talking NTD, neglected tropical diseases. Yeah. What are these diseases about? What is a neglected tropical disease in the very first place, and how rampant are they?
Okay, thank you very much. Neglected tropical diseases are a group of about 20 disease conditions that are found commonly in the tropical and subtropical parts of the world. Nigeria as a country is in the tropical part of the world. And disease conditions that are closely associated to poverty, poor sanitary conditions, poor access to potable water, poor access to quality healthcare, services. And they are termed neglected because they don't receive the kind of attention other disease conditions receive. And apart from that, most of the people that suffer from these disease conditions are stigmatized against, and they affect the world's poorest. When things affect the poor, most times they are not really given that level of attention, they should get. And apart from that too, these are disease conditions that have a high morbidity, but a relatively low mortality rate, in the sense that they could affect you for a very long time, before maybe it takes your life, as compared to other conditions like malaria, HIV/AIDS, Ebola, virus disease, COVID-19 that will, take your life almost immediately. So because of these reasons, they don't really get the kind of attention they should get. And in terms of the control and elimination strategies, these conditions have been divided into two subgroups. You have what we call the preventive chemotherapy NTDs. These are the ones that you can give drugs to prevent and to also control them. So under the preventive chemotherapy NTDs, you have disease conditions like lymphatic filariasis. Lymphatic filariasis is also called elephantiasis. They are transmitted by mosquitoes, and the people affected present with swollen legs. That's why you drive on the road, you see some people with swollen legs, or for the men, their scrotum is swollen, and other parts of the body. Even in women, the breast could be enlarged, or even the upper arm and all that. So those are complications of lymphatic filariasis. Then apart from that, you also have onchocerciasis, also called river blindness. The vectors are the black fly. So apart from causing blindness, it can lead to one having difficult rashes on the bodies that are very difficult to treat. They also have the soil-transmitted helminthiasis or intestinal worms. I'm sure we all know about worms. Worms really have a huge impact on children and all that, and even maternal health. So these are transmitted when the water sources, food, fruits, vegetables are contaminated, they're not properly washed, and they're ingested. So this leads to the people having a large burden of worms in their system, which could lead to them having anemia. I mean, like most time when women are pregnant, when they go for antenatal care, they are given drugs to deworm them. Because when women are pregnant, physiologically their hemoglobin level drops. So if you have a huge worm burden on you, it further drops hemoglobin. It could lead to the woman having severe anemia, which could affect the growing fetus. So it could lead to the fetus not growing maximally. So you have what we call intrauterine growth restriction or retardation. And if it's very severe, it could even lead to the death of the fetus inside the woman. Then even for the pregnant woman, if the anemia becomes very severe, she may need blood transfusion, and it may even lead to her having anemic heart failure and even dying from that. So it shows the seriousness of these intestinal worms. Then even in the growing child, That's why most times you hear, oh, children are stunted, they are not growing up to the heights they should grow and all that. Because the first 5 years of a child's life are very important. So if the child has a huge worm burden, the child is not going to grow maximally to his or her full potential in terms of physical growth. Then it also affects the child's cognitive functions. So the child does not do well in school. So the child grows up because the brain is not fully developed. The child grows and can't really be very useful to his or herself. You also have the schistosomiasis. Schistosomiasis, those ones are transmitted by water snails. Those ones lead to people, urinating and seeing blood in their urine. And it could become very severe to the point that the person may need blood transfusion or even lead to death. They also have trachoma. Luckily for us, trachoma is not endemic in this part of the world.
Okay.
So trachoma also leads to blindness. And
So our NTD is endemic. Like, when we have epidemics, it just, spreads out. So in Nigeria, NTDs are endemic. Like you said,
yes,
poverty is a real factor.
yes,
But I think something that's really alarming this morning as I'm listening to you speak is the seriousness that should be attached to these diseases, because it's more like they are everyday experiences around us, but they're rarely talked about.
yes.
And okay, so one thing you're also really emphasizing is that one that affects people because of the strength of worms in them.
Yeah.
So naturally, someone would ask, how often should we deworm ourselves? And what are the things that we can naturally do in our homes? Do we have to go to a medical facility to get dewormed? And how often should we do this? So that the little we can do to keep safe, we are doing those things.
Okay. So thank you very much. I was just going through the NTDs. So apart from I'll still come to your question, but apart from the preventive chemotherapy NTDs, you also have the case management NTDs. Under the case management NTDs, you don't really give drugs to prevent those ones. Those ones have occurred. So you now, implement certain strategies. Maybe you can give anti venoms and stuff like that. So you have conditions like snake bites, dog bites that can lead to rabies. You have Bruley ulcer. You have leprosy. You have yours, leishmaniasis, sleeping sickness. And even scabies are also part of the case management NTDs. And prior to this time, you had what we call guinea worm disease, which has now been eliminated. So coming to your question now, for deworming of people, we advocate that people should be dewormed at an interval of every 6 months. So six monthly, you go get dewormed and all that. Then what we do, between the first 5 years of life, the children could get deworming drugs from the primary health centers. Those ones come under the primary health care development agency plan. But for us as a program, we deworm children from 5 to 14 years. Okay. So we have our school-based campaigns where we go to the different schools and we use the teachers. The teachers, administer the drugs to the children who have been enrolled, in their different schools. So we do that routinely, at times twice in a year or at times once in a year, because we get our drugs from the Federal Ministry of Health, and the drugs are gotten from donors, but they are facilitated by the Federal Ministry of Health. Okay. So everything is dependent on the availability of the drugs, but every year we deworm, our children, because, in Akwa Ibom, all the 31 local government areas are endemic for the intestinal worms, and the factors are everywhere, because, for instance, now, we have a strategy called the water sanitation and hygiene, which could also help to reduce the incidences of intestinal worms infestation, because, you need to wash your hands properly. People go to the toilet, people eat food, so they need to wash their hands properly before they eat and all that, because, if there's any contamination in the course of you maybe ingesting, you could swallow the ovaries of the worms and all that. Okay. Then apart from that, there's a lot of open defecation in this part of the world. And, the wash strategy also helps to reduce open defecation, because, we have a high level of rainfall in this part of the world. And since water sources are mainly streams, rivers and all that, people go to the farms and places around the house to defecate, and the rain just falls, washes it off, it gets to the water sources, somebody else goes there to fetch and
And then
drink,
that the
prepare
problem
food and all
continues
that.
to
So
spread.
the vicious cycle just continues.
Okay.
You know.
So we also meant to have a conversation around drug harms and reduction of drug abuse this morning. We had our guest joining us virtually. I don't know if we can take a question from him this morning. I don't know if he's still online. Of course, we're supposed to have NTD, who is the chairperson for Drug Harm Reduction Advocacy, joining us. Good morning, NTD. Sorry for the inconveniences joining us this morning, but let's take a quick swipe. Even if it's just a question we can handle, then we'll take you again next week. Better, conditions. So we are looking at advocacy against abuse of drugs in the society. Today we are creating that awareness. What is this about? We are seeing that a lot of persons are abusing drugs in the society, and your agency and the international community have come together to raise awareness on the part of citizens. Does that, give us some intel on that?
Okay, good morning.
Good morning.
Can you hear me?
Absolutely clear.
Okay, thank you for having me. We are Drug Harm Reduction Advocacy Network. Advocacy is towards human rights approach to drug use and how we handle drug use in our society. What we know is that the world is having a rethink of how we go about drug laws and how we go about treating people with issues of drug abuse. And the rethink is towards a human rights approach to drug use issues because it's now recognized day by day that it is not a law enforcement issue, but a public health issue. Public health in the sense that it involves talking about the person you have with you, Dr. OIS, has talked about looking at preventing infectious diseases like HIV, other blood-borne viruses like viral hepatitis, and all of that. And these are really from the use of injecting drugs, and also looking at other risk factors that are involved in drug use apart from injecting drugs. So what we are now advocating for or talking about is that instead of going the route of anybody who is found with drugs, like stated in the NDLEA Act, or known to use drugs is arrested and locked up, we are saying that there's another approach which is called harm reduction, looking at those who are already using drugs, reducing the harms that comes to them as a result of their drug use. And the idea behind this is to keep them alive long enough to be able to make the decision to stay away from drugs. But also, on the other hand, also talking about preventing drug use, looking at integrated strategies, including school programs, including enlightenment of parents, including, pushing for government funding for treatment centers for people who use drugs, at least where they can, people can go and talk about, oh, I've started using drugs, or my friends introduced me to drugs. How do I stop it? Because I'm getting hooked. Because if you look around, apart from the Center for Research on Information and Substance Abuse, CRISA, we do not have drug treatment centers. Apart from not having it, they are not integrated into our healthcare system. So today we are talking about universal health coverage. And yet, if you look at our primary health centers, you look at our secondary health institutions and facilities, and the tertiary health facilities, we do not have a drug treatment program. And this is in a country where about 14.3 million people within the age of 18 and 35 have used drugs in the past 6 months.
So, Anedi, there's a
So,
concern at that I want you to iron out. When we are talking drug overdose, someone would think, now listening to you, I can hear lots of hard substances in the conversation. Does this also cover for over-the-counter overdose of medicine? Right, when we are talking of drug overdose, are we just talking hard substance, or the fact that we see that people overdose on things like even paracetamol, Vit C, and all of that? Are those some of the conversations you're also covering in this awareness beyond hard
okay, so
substances?
I wouldn't say people overdose on stuff like vitamin C. I think maybe what we can talk about is when people want to commit suicide, they take too much of a substance. But when we talk about overdose, we are talking about opioid drugs. We are talking about
Mm-hmm.
things like tramadol. We are talking about things like codeine, and drugs that are in the opioids family. And we are noticing that young people are increasingly using those drugs not to cure or to solve particular health issues, but recreationally, and to get a high from it. So we're also talking about that also, because if you notice in the north, there's been reported cases of young people getting into seizures, and most times parents and those who are around them do not understand the reason why those seizures are happening. But it's mostly from tramadol, overramping, because we don't call it overdose. So we are talking about how do we prevent young people from who should be productive in the country from dying from overdose, because overdose the world over is killing people, especially now where we have fentanyl coming into the market through the US, being mixed with heroin and so many other things. So we are advocating for the government to not just look at drug use issues, but to make available essential medicines, in the essential medicine list. For example, naloxone is an essential medicine because it helps to reverse overdose.
Okay.
We do not want to lose lives because of overdose. So we are
All right.
saying government should make available in all facilities, and then not just all facilities, but also create awareness for parents, because sometimes parents don't know why their children will just stay
Going to
and then
seizures.
overdose and die. So that is our advocacy.
All right. And Eddie, we definitely have to have this conversation more holistically. The time that we're able to get to join us doesn't allow us to, go in depthly to the conversation. But, Doctor, just before I let you go, we have
Yeah.
NTD summits coming up.
Yeah, sure.
What's this summit about? What are we hoping to handle very intrinsically? And when you bring it down to Akwa Ibom State, do we have the presence of the state government and the governor trying to see how we can infiltrate our local government to make sure that people living with NTDs are duly handled? Like you mentioned, on our streets we have them. Is there a way to take them off the street and provide care for them and just elongate their lifespan like you talked about?
Okay, thank you very much. What we're having is going to be the first NTD Stakeholder Summit in Akwa Ibom State. So it's a state-based uh, summit. It's not like a national thing. It's Akwa Ibom that is organizing this for the first time. And the theme is enhancing domestic resource mobilization towards sustaining NTD's control and elimination in Akwa Ibom State. Because from my experience in the last 3 years, we've been able to mobilize resources domestically for some of our programs. Like when we started the hydrocele surgeries under the Mobility Management and Disability Prevention Strategy, we're able to partner with NSEC Integrated Services Limited, and we're able to do 13 surgeries. Then afterwards, we've done more than 300 right now. Then we have also been able to mobilize resources domestically to, carry out our flag offs and all that, and some other things. So we now realize that even those that have even contributed something don't really know so much about NTDs. That if we were able to bring them together, stakeholders, from the academia, professional bodies, the private sector, public sector, and all that, and we rub minds, we share more information about NTDs, we maybe get them to know more about the challenges, the gaps. There could be some people that are willing to do something to support. Because from my experience, there are quite a number of people, public spirited individuals, philanthropists who want to, add value to the lives of people, and they don't really know how to go about it. So we can share all these challenges with them and the gaps which they could help to fill, to add value to the lives of our people.
Is the Akwa Ibom State government directly involved with the NTD summit?
Yeah, definitely. The program is the NTD's Control Elimination Program is a program of the Ministry of Health. Okay. So the ministry is piloting this. So we're expecting His Excellency the Governor of Akwa Ibom State, Pastor Moino, as a special guest of honor at the event. So that's what we're planning to do on the 7th of September at the banquet hall of Ward Bridge Hotel in Uyo.
So we are hoping that we can have Akwa Ibomites and people come out to, be educated as to what neglected tropical diseases are about.
Definitely. And we're also going to invite some of our beneficiaries. They could come share their success stories, because the way the NTDs present, most of them, people feel they are due to spiritual attacks and all that.
Okay.
But by the time people who have benefited come to share their stories, and people get to see that these are medical conditions, that have medical solutions, we believe that it will help to further help in the control and eventual elimination of the NTDs.
All right. We really would have loved to go into more in-depth detail, but you can catch up on the conversation that we have had with our guests this morning. Of course, we've been looking at neglected tropical diseases, and Dr. Anyekeme Uwa has been our guest. He's the state coordinator of, for NTD's control and elimination in Akwa Ibom State. There is a summit coming up to educate people on what this disease is, majorly about. But catch up on the conversation we've had so far so that you can receive a first-hand education. SpectrumTV.ng is where you can find all our social media platforms to keep abreast with the information that we have brought to you. A great thank you to you for taking our time to come this morning.
Thank you.
But that's the much we can take on Rise and Shine this morning. We apologize for the brevity of time to be able to expatiate on most of our conversations. But of course, we'll bring you more information, more details, more stories on Rise and Shine next week. For all of you who were part of Rise and Shine Monday through Friday, we appreciate you. Until next week, my name remains Uyai Anyeka. Do enjoy your weekend. Bye-bye.